The transition to postless hip arthroscopy was smooth, and I was highly motivated to find a better way of performing hip arthroscopy and hip surgeries. And I found that with doing the surgery without a post. The surgery was actually easier. I found I had better exposure, better distraction. So with the traditional method of using a post, you encounter increased risk, particularly of pudendal nerve injuries and lacerations, ulcerations, urinary issues, sexual dysfunction. Those are all real risks that are present with using a post. When we made the transition to going postless or not using a post, it eliminated those risks and allowed us to perform safer surgery by completely eliminating that complication. What I found as I did that was that there are other benefits as well to going postless, to include better distraction. Okay, it was not only safer, but I found that I had more space and the surgery was easier to perform. I felt like I not only eliminated those potential risks, but I was offering the patient a whole lot better option. Surprisingly, I also found that patients were having less pain. I've had a patient that had one hip done with the post and one hip without the post. Also, I had that same patient say that how much faster he recovered the second time and that he didn't wake up with this pain in his groin, which he was very appreciative of. The pink hip kit could be used for almost any hip procedure or hip surgery that you do. I use the pink hip kit in particular for hip arthroscopy as well as periasteral osteotomies, certain trauma cases, as well as there may even be some use for it in total hip replacement as well. The future of hip arthroscopy is doing it without a post. Patients nowadays are educated and they know what to look for. And if they know that there's a better, safer way of doing it, they're going to find that. And using the pink hip kit is the way to help facilitate doing hip arthroscopy without a post. And that is, ever since I made that transition from using a post to not using a post, it's been a tremendous difference in my practice as well as acquiring patients. But I will never go back to using a post now that I've made that transition.